is Shana.
And my name is Dr. LaGrone.
And this is Jeff. Today we're at Custer McDermott Animal Hospital.
And we're going to demonstrate proper blood collection technique with Jeff here. So the first step of collecting blood is to make sure that everyone is safe. So the first thing we're going to do is apply a muzzle here to Jeff, who may become upset during his blood draw procedure. Okay, the next step is to make sure you have all of the proper equipment that you'll need for your blood draw. Today, I have syringes, I have blood tubes, and I have some alcohol. We're going to demonstrate 3 different sites for collecting blood. The first is the jugular vein, which is located on the underside of his neck. The second is the cephalic vein, which runs down the front of each of his forelimbs. And the last one is this lateral saphenous vein, which runs kind of on the outside of his knee, down to his toes on the outside of his leg. If you're collecting more than 1 milliliter of blood, it's best to draw from the jugular vein because get a little bit more from that draw than you would the other ones. They're little smaller vessels. So Shana here is going to restrain for me. We're going to make Jeff sit, if he will. Good dog. Okay. She's going to hold back his ears, his little leash, and I'm going to hold off on the vessels. I'm applying light pressure to the skin just so that I can feel the vessels under the skin. I'm going to apply a little bit of alcohol. It just helps wet the fur so you can feel the vessel a little bit better. I will not uncap the needle with my mouth, as that's not safe. Once we've got our sample, Shana's going to apply light pressure, and the blood is going to go into the tubes. Notice how I'm not pushing the plunger down. I'm letting the negative pressure in the inside of the tube fill it for me. That way it prevents the blood cells from rupturing from pushing down on top. That can change our lab results. Once they're filled, I'm going to slowly invert them side to side to mix them with the anticoagulant inside. Okay. Off to the lab. All right, now we're going to do the cephalic vein. Shana is going to hold his arm at the elbow and apply pressure while wrapping the vein to the side. The use of alcohol is especially helpful in really fluffy animals like Jeff here. And then this side you can kind of see the vein almost as well as you can feel it there. Again, I'm not uncapping the needle with my mouth. It's a bad habit to get into. And there we go, a small amount of blood for a heartworm test maybe. Okay, and then once we're sure it's no longer bleeding, it looks good, we'll move on to the last site. So it's not to fully harm Jeff. I'm just going to show you where it is. We won't stab him a 3rd time. You can feel his hock is about here. His knee is about here. I'm going to go about halfway between those. Wet the fur down. Shana is just applying circumferential pressure all the way around the limb. And there's our little vessel. It wraps from here all the way back here. This is perhaps the most difficult location to get blood, but if you've already tried at other sites, it might be a good option as well. I will have gotten my blood, and Shana will apply pressure to the outside of the leg once we're done. And that's the end of blood draws here at Custer McDermott Animal Hospital. I hope you've learned something today.